अभी तक हमने health economics, finances and all disruptions, and the real disruption is this which I want to talk today now with you, which is happening in our society. And it's going very fast. So this real disruption, we need to know why this is happening. Can we stop it? Can we prevent it? What measures we should take? So I'm by profession a cancer surgeon, an onco surgeon, and has been practicing oncology since last 20 years in Jaipur now. This is my institute where I work, is Mahatma Gandhi, it's Medical University, Shri Ram Cancer Center. So it will be a bit of interactive session with all of you. I'm having some otitis media, so I'll be speaking slightly slow and not loud much. So how much of we sitting here say cancer is preventable? Is it preventable or not? So please read, is preventable or not?
Preventable.
So hardly 6 and 7 heads are there which say that cancer is preventable. But I tell you, 60% of cancers are preventable in India. The first important point, we'll discuss the slides further. Is cancer curable? Please raise the hands. Hardly again 15 guys. What more than that? It is curable. We'll discuss. And advanced cancer is treatable. So how does it work out? So what is a cancer? Some basic, everybody has read about cancer. It's proliferation of some cells in the body. And every part, any part of the body can be affected by cancer. Right? So that irregularly these cells proliferate, increase in their number, and then gradually spread in different parts of the body. Simple terms, nothing much. And why? Why we get advanced cancer? So we don't have awareness in our society about cancer. As I've seen just now, we are not aware about cancer today. Is it preventable or curable? And we have a late diagnosis because whenever anybody comes to us, they come in an advanced stage. If I give a comparison to you, we get 60 to 70% of cancer in stage 3 and 4. In America or Europe, 60 to 70% cancers on stage 0 and 1. That's the difference. And that's why our outcome is very poor. If we see data all over the world, around 18 million people suffer from cancer every year in the world. And of those, 9.5 million dies of the cancer. There's a big scenario. It's a horrible scenario. And we, in the society as India, are going towards that epidemic of cancer now. Right? Previously, I'll give the slides, the numbers also. If we talk of female cancer also, we say females does have more cancer. Males, they are growing with number of cancers now. So in the world, every country has a different type of cancer as commonest cancer. In India, tobacco chewing is commonest. Tobacco taking is commonest. So tobacco-related cancer are commonest. In the world, it is prostate cancer. If you talk prostate cancer is commonest in Europe. If you talk China, stomach cancer, esophageal cancer is commonest. So depending on the habits that we have, the lifestyle that we are leading, what we eat, what we smell, what we take breath inside, the type of cancer. In India, every 200 kilometers, the culture changes. So the cancer incidence also, and the type of cancer also changes. When I was doing my MCH in super specialty in cancer surgery in Chennai, the commonest cancer in Chennai is stomach cancer. When I started practicing in Jaipur, Rajasthan, the commonest cancer is oral cavity cancer and lung cancer. Because the habits are different. खाने पीने का तरीका different है, जो हम खाते हैं वो. So that changes, that's how the cancer type also changes. Talk of female cancers, commonest cancer in females in the world, out of 152 countries, 190 countries, 152 countries as commonest cancer is breast cancer. In India also the scenario has changed. Previously it used to be cervix cancer commonest. Now the breast cancer is commonest in females. Why? Because of the lifestyle changes. So this photograph, which you can see the 1990 incidence of cancer in India and now 2016 incidence of cancer in India. Previously, out of 100,000, out of 1 lakh people, only 30 to 40% used to get cancer. But now it is reaching up to 120 people. So this scenario has changed in the last 20-25 years. Why? It's because of the technology. Why technology is disrupting our health and cancer is increasing? We'll further discuss in the slides. So you can see this graph that in males and females, the cancer incidence is increasing day by day in India also. Though our incidence is less, if we talk of incidence in America or Europe, out of 100,000, 330 or 400 people will have cancer. In India, maximum it is 100 people will develop cancer. But we are heading towards Europe because our life is like that. It has changed. A lot of news we generally read in the newspaper, the cancer incidence is going to increase by 500%, or 400%, or 15% in India. There are risk factors for developing of cancer. What are those? As the age advances, in every person the cancer chances of developing cancer increases. We cannot do anything. We cannot be of 20 years of age always. The technology will increase, so the cancer incidence also increases. Commonest cause of cancer in India used to be tobacco, alcohol, smoking, tobacco in any form. But now this has been taken up by other factors like environmental exposure, that in black action. The pesticide, the massive use of pesticide to grow the plants and the crops, air pollution, food adulteration. So, and the other things like obesity, less of physical activity, no exercises, unsafe sex, viral infection and sun exposure. These are the causes. In India, previously tobacco was the leading cause of cancer. Now environmental pollution, pesticide, these are taking up. And that's why we are getting cancers which used to be at the age of 60 previous, around 20 years back, in a younger age group. The younger age of cancer is increasing. A lot of news about, Keetnashak se cancer and the number of incidents of cancer increasing. Every day we read in newspaper. You know this figure, Z News, Sudhir, he does very clearly. He did a very simple study. He took some vegetables from the Delhi पे जहाँ पे वो यमुना रिवर पे उगाते हैं ना, उन्होंने कुछ vegetables लिया, उनका analysis किया. And what they found that the arsenic content in the vegetable was 209. Which should be less than 0.1 in the vegetable, 209, from 0.1 to 209. Same mercury should be less than 1 ppm in the vegetable, it was 105 or 139. So cancer क्यों नहीं होगा? We are eating them in thousands. It's micro में है, ppm में है, but आप thousands में खा रहे हो. What we are eating is causing this. सब बोलते हैं हमारा तो स्मोक ही नहीं करता, अल्कोहल नहीं करता, कैंसर हो गया. We are eating cancer every day. We are eating chemicals every day which is causing cancer. It's a horrible situation. So we analyze what we are eating, we'll know what we are eating. That's why the cardiac diseases and cancer diseases are increasing drastically in our society now. Again, what is not adulterated? हमने क्या नहीं किया खाने के साथ में, तो दूध से लेके पानी से लेके सब में ऐसे ऐसे तत्व डाल दिए हैं, केमिकल्स डाल दिए हैं खाने में, रोटी में, ज्वार में, you name a vegetable, you name a grain, we have put everything in that as a chemical to prevent the increasing the pesticide content in that and causing cancer. It's horrible situation we are on. So there are ways to do farming, jaivic farming. होना चाहिए, बढ़ना चाहिए, but who is taking initiative? Nobody, because everybody wants to earn money. Whatever ways, somebody dies or not, develops cancer, we want to earn money. Farmers are doing well. क्यों? क्योंकि यूरिया डाल रहे हैं, पेस्टिसाइड, जो पेस्टिसाइड यूरोप में बैंड हैं, don't imagine, वो टन्स में हमारे हिंदुस्तान में यूज होता है. Nobody wants to stop them. The government is giving funds for cancer treatment, but cancer prevention, nobody is thinking. Very sad status. And why, as I discussed the risk factors with you all together, tobacco, a big industry. सब लोग बहुत लोग के रिलेटिव्स tobacco industry में काम करते होंगे, but this is a big headache also. It is causing a lot of diseases, cardiac diseases, pulmonary diseases, lung diseases, renal diseases, cancer diseases. It's a horrible plant. So every year, 55 lakh people worldwide die of tobacco-related diseases. It may be cancer, it may not be cancer also. And in India, 3,17,000 people die every year because of tobacco-related diseases. Every day 3,500 people die of it. That's the stats. This is only stats which is written, which is documented. इसके ऊपर तो पता नहीं कितना है. इंडिया में तो definition बहुत ही poor होता है. You know everybody the status of India. And I tell you, 40% of the 60% of cancer are because of tobacco in any form that we are taking. Whether you talk of snuffing or you talk of smoking or inhaling or chewing and other ways. In one cigarette or a tobacco sachet, we say, the chemical analysis say that it has 70 named carcinogens. एक टोबैको के सैशे में या सिगरेट में 70 कार्सिनोजन होते हैं जो कैंसर करते हैं. 70 तरह के कार्सिनोजन होते हैं. And it has got 7,000 chemicals inside. So what we inhale as a smoke or what we eat as a tobacco, we are taking 70 carcinogens named का जो कैंसर करेंगे ही करेंगे. फिर क्वेश्चन ये आता है कि सब बहुत लोग पीते हैं, सब पे तो कैंसर नहीं होता है. डेफिनेटली नहीं होता है, बट those persons who are using tobacco has a higher risk of developing cancer, higher risk of developing cardiac diseases, myocardial infarction, heart attack, cerebral hemorrhages. The risk is very high. So, tobacco को तो हमने हर तरीके से खाना ही है. So there are different 1,000 ways of eating and snuffing and taking tobacco. It is so contagious. Nicotine लेना है तो लेना ही है, right? So these are the different ways people eat and drink and smell tobacco. 16 types of cancers are caused by tobacco and its products. If I start from mouth, मुंह का कैंसर, गले का कैंसर, फेफड़े का कैंसर, ब्लैडर कैंसर, बच्चेदानी का कैंसर, pancreatic cancer, stomach cancer, esophageal cancer. 16 types of cancer. It is proved is caused by tobacco. Still you want to smoke, you want to smell and you want to drink it. The person, there was a study done by Dr. Lalit Kumar from All India's Medical Sciences. He's a lung surgeon, CTBS surgeon there recently. And they showed that in his clinic, every month, 5 to 6 patients, young ladies of age 20 to 28 years of age, come with lung cancer. It was a recently published study. अब उन फैमिलीज में जहाँ पे वो लेडीज आती हैं, उनके यहाँ कोई स्मोक करने वाला नहीं है, तो फिर इनको लंग कैंसर क्यों? और वो भी एज 25-28 ईयर्स में, जो वर्ल्ड लिटरेचर में है ही नहीं कहीं पे लिखा हुआ कि 25 साल की लेडी को जो स्मोक नहीं करते और फैमिली में कोई स्मोक नहीं करता उसको फेफड़े का कैंसर हो जाएगा. वाई? बिकॉज सेकेंड हैंड टोबैको इज वन ऑफ द रीजंस होता है. इफ यू डोंट इवन स्मोक, द पर्सन इज स्मोकिंग इन फ्रंट ऑफ यू, you will have the effect of it and you have a 20% higher chance of developing the cancer. That is known as second hand tobacco smoking. Second menace which is coming, pesticide use. Massive use of pesticide which is banned all over the world. We are using in tons in India. You can have videos from Punjab, Haryana. पेपर में ये भी आया था अभी पत्रिका में जयपुर में कि पंजाब हरियाणा का किसान राजस्थान से गेहूं लेके जाता है बिकॉज यहाँ पे पैसे का यूज़ कम होता है या नहीं होता. दिस इज द डिफरेंस. एंड लॉट ऑफ माई पेशेंट्स आर फ्रॉम दिस एरिया बेल्ट, पंजाब हरियाणा, श्रीगंगानगर एरिया. वो कहते हैं डॉक्टर साहब हम जो उगाते हैं ना उसको हम नहीं खाते, बेच देते हैं, धार दूसरी जगह से लेके आते हैं जहाँ पे यूज़ नहीं होता पेस्टिसाइड. एंड दे आर सेइंग इट वेरी क्लियरली, देयर इज नो शेम ऑन दैट. देन आई आस्क देम कि भाई क्यों ऐसा क्यों करते हो आप? सब मालूम हम क्या डालते हैं. दे नो इट वेरी क्लियरली. They are using pesticides which are banned, which are carcinogenic, which causes sudden myocardial infarction, heart attack, brain hemorrhages. So they are not using their own product, which they are cultivating in their farms. That's the scenario that we have. Then different way of adult. हमने क्या नहीं इंजेक्शन डाल दिया है fruits के अंदर. We have put the injection in the ghee. Lot of things we have done, make adulterate things. एंड वी डोंट नो कि हम जो आज खा रहे हैं या आज खाएंगे या घर पे खाएंगे उसमें कौन से में क्या केमिकल है. एंड देयर इज नो वे आउट टू डू इट. आप बाजार जाएंगे, सुंदर सी आपको घिया मिलेगी, जस्ट परचेज इट, इट्स ए ग्रीन. बट आई टेल यू, आई हैव सीन इट बाय माय आईज. जस्ट पुट इन अ केमिकल, पुल इट आउट विद इन 5 मिनट्स, यू विल फाइंड इट्स सो ब्यूटीफुल, इट इज सो ग्रीन. घर ले जाओ खाना बनाएंगे, बहुत अच्छा ग्रीन है. इट्स नॉट राइट. पहले ये कहते थे बचपन में, जब हम थे बचपन में कहते कि जिस सब्जी को कीड़ा खाता है वो नहीं खानी चाहिए. राइट? एग्रीड? अब हम ये बोलते हैं कि जब वो कीड़ा खाता है वो खानी चाहिए. क्यों? क्योंकि कीड़ा जिसको खाए वो अगर उसमें पेस्टिसाइड तो मर जाएगा वो, इसका मतलब उसका पेस्टिसाइड नहीं है. Scenario is totally changed. So one of my senior oncologists from Tata Hospital, he came to a meeting to us in Jaipur. Very interesting thing related to that also. I asked him, boss, आप कैसे पहचानते हो कि सब्जी में पेस्टिसाइड है कि नहीं? बोले जो कीड़ा खाता है वो खाओ. That's a fact. भी कीड़ा उस सब्जी को तो नहीं खाएगा, खा के मर जाएगा जिसमें पेस्टिसाइड है. So this is how we are growing. और आप देखिए किस चीज़ में हमने गंदगी या केमिकल नहीं डाले. रीड आउट दिस. खाद्य तेलों के अंदर, सब्जियों में, पाम ऑयल, मिल्क, चावल, माय गॉड ह्यूज. You name any edible, we have put chemicals in that to earn money out of it. And टूथपेस्ट में भी डाल दिया, चाय में भी डाल दिया, चाइनीज फूड में भी डाल दिया, मसालों में भी डाल दिया, अजिनोमोटो, मेलामाइन, ह्यूज कैल्शियम कार्बाइड से तो हम आजकल एप्पल्स को पकाते हैं ताकि इट्स ऑल प्रूवन कार्सिनोजेनिक. नाउ नेक्स्ट, व्हाट आर वी गिविंग आउट ऑफ दिस ऑल? आपने बिजनेस मीटिंग करा, इतना इंडस्ट्रियलाइजेशन हो रहा है, चीज़ें डेवलप कर रहे हैं, बट डू वी नो व्हाट वी आर गिविंग टू आवर नेक्स्ट जनरेशन? आर वी गिविंग ए क्लीन एयर टू द जनरेशन? नो. आर वी स्मेलिंग द एयर? What is the PM 2.5? If I ask anybody here sitting of Kolkata today,
it is good because
it is wet. It was wet yesterday. That's what. But what is the PM 2.5? It is used to be. I have read on. I was just preparing this. I just go to on Google. The PM 2.5. We know it air quality index. Everybody knows about it. It's a big bug in the news. The PM 2.5 of Jaipur, Kolkata used to be around 160 somewhere, right? What does it mean? It means that sitting here, everybody in this hall is smoking at least 8 cigarettes per day. You may not smoke a cigarette, but it is equivalent to that. So Delhi का PM 25 दीपावली पे 1200 था. What does it mean? 60 सिगरेट वहाँ पे हर आदमी रोज पी रहा था. जो बच्चा पैदा हो गया दिवाली वाले दिन 60 सिगरेट पी रहा है. और उससे क्या होगा? 20 साल में कैंसर होगा ना फेफड़े का. क्यों नहीं होगा? चाहे वो स्मोक नहीं कर रहा, फैमिली स्मोक नहीं कर रही हो. बट आप तो जो पॉल्यूशन आपने कर दिया, गाड़ियाँ लेके कि घर में 4 गाड़ियाँ हैं, 6 गाड़ियाँ हैं, क्या कर रहे हैं उससे? पहले एक घर में एक गाड़ी होती थी, 2-4 स्कूटर साइकिल होते थे. अब हर घर में 4 में तो 6 गाड़ियाँ होती, 5 गाड़ियाँ होती. What is the average and what pollution we are giving to our kids? और जो फ्यूम्स उससे निकलते हैं, अब एक बार रूम बंद करके गाड़ी चला के 5 मिनट बैठ जाइएगा गाड़ी के बाहर, यू कैन नॉट टेक ए नॉर्मल ब्रेथ देयर, क्योंकि उससे जो सल्फर डाइऑक्साइड निकलता है, कार्बन मोनोऑक्साइड निकलता है, केमिकल्स निकलते हैं. Those are carcinogenic. Those are causing heart attacks in early age, cerebral hemorrhages in the early age, cancer in the early age. हम जब when I was doing my super specialization in Chennai, तो जो कैंसर मैं 60 साल की उम्र में पढ़ता था मेरे लिटरेचर में, मेरी बुक्स में, वो मैं इंडिया में 30 साल की उम्र में देख रहा हूँ. वेरी सिंपल स्टोरी. वन थिंग विच हैज हैपेंड विद मी लास्ट मंथ. 2 sisters came to my OPD. They went to college, both together. एक सिस्टर सिर्फ घर का खाना खाती थी, कैटेगरी they told me, and another sister was she wanted to eat only pizza and pasta and तो मार्केट में जो मिलता है वो सब. तो 2 साल सर मैंने तो बाहर का ही खाया. You know that girl who was eating outside had a rectal cancer which has spread to all parts of the body. This is the youngest patient I have seen. She was 19 years only. And मेरे सामने within 2 months she died. I could not do anything. Because younger cancers are so aggressive that, and there is no treatment for it. Whatever treatment you give to those younger cancers is not effective at all. They are so aggressive, they spread so fast in the body. So beware of what you are eating outside also. Pizza, pasta, the way it is cooked, the condiments that has been used for it. So these are the things. So pollution, we are polluting everywhere now. जहाँ पे भी गाड़ियाँ हैं, industries हैं, huge amount of pollution we are giving to this earth. We are making it a polluted earth, and we are getting the diseases out of it. Air pollution में हमारे, you can see the name of the cities, they are the top in the world today. 7 cities are in the top in the world today as far as air pollution is concerned. And it is a proved carcinogenic today is air pollution also. So what happens when you pollute, when you smell the polluted air? The right side of pink is the normal lungs that we have, and that side is the air polluted smell lungs. So इतना tar, इतना black soot, इतने chemicals, definitely color from pink goes down to black. And this is a normal adult status. So these are the colors of the, on the extreme right is the normal lungs that we have, we got from our father and mother. And then you get usually blacker lung, the darker lung, because of the inhalation that we do of pollution. Still blue light is, this blue light with LED lights that we have, there's a study from Barcelona, it clearly says, पहले एक बल्ब होता था घर के अंदर, रात को 15-20 बल्ब तक नहीं हुए तो शांति नहीं मिलती घर वाली को भी, अच्छी वाली लाइट्स लगाओ, छोटी-छोटी लाइट्स लगाओ. The blue light is a cause of prostate cancer and breast cancer proved now. Yellow light, जो सूरज से आती है, this color is good, this is okay. But the white light is also one of the carcinogenic causes of cancer. It's a study that was published from Barcelona. Coming to some commonest cancer, I'll talk of head and neck, 5 minutes only, and the breast cancer. Some details that we should know. We have the commonest cancer in India is head and neck cancer. Tobacco is the cause that we discussed just now. A simple thing that we can do, whoever uses tobacco, please check your mouth once in a month, see the lip, see the oral cavity, see the different parts of the oral cavity, because this is the common site of cancer. If you find anything abnormal like white patch or a red patch or an ulceration, which is not healed which is not healed by medication of 5 to 10 days also, please go to a doctor, get a biopsy done and confirm it should not be a cancer. Because we're going to wait for some time, it's going to increase if it is a cancer. So please check your oral cavity always. Once in a month, if you find anything abnormal, we can see it in the mirror clearly. When you find anything abnormal, please rule it out that it should not be cancer. There are 8 steps to examine the lips to the tonsil. Simple. You can get everything in the net, everything is available there. So anything abnormal, as I told you, color, shape, size, neck swelling, anything you diagnose, please go to your doctor. So these are the red patches. You can see the white patch here. This is a red patch here. There's an ulceration here which is not healed because of a 5 to 10 days treatment. Please go to your surgeon or a physician. Rule out there should not be any cancer there. A simple biopsy test is sufficient for now. And not afraid of biopsy की biopsy करने से फैल जाता है, ऐसा आज तक नहीं हुआ है. नए ट्रीटमेंट करने से अगर वो कैंसर है तो बढ़ेगा और फैलेगा. That's the crux. So white patches are there on the tongue, red patches, you can see the photographs here, the white patch here. A simple examination can make it out. So big ulcers that we have operated. So a lot of common head and neck cancer we operate in Rajasthan, Jaipur. Big surgeries, we have removed jaws and made jaws, a lot of things we have done with good survival outcome. Cancer doesn't mean that the patient is going to die. Please diagnose it in an early stage and they get a complete treatment is the crux of it, right? So these are the different patients which I have operated and they are okay for 8 years, 10 years, 12 years, but they come on the time. So whenever we talk of treatment, it is surgery, chemotherapy, radiation, depending on the stage of cancer and the general condition of the patient, we make a protocol of treatment that should be rigorously followed for cancer treatment. So we have a lot of drugs for it, radiation and all. So as smaller the cancer we treat, the better is the outcome. The larger the cancer we treat, the poorer is the outcome, whatever we do. How much money we spend. So stop tobacco and alcohol, have a good healthy lifestyle and diet, and early detection by screening is a must. We can screen in ourselves every month once, seeing the oral cavity, any abnormality. Coming to the commonness for the females, 1 in 22 females in India develop cancer, breast cancer. And we get younger cancers of breast cancers now in our OPD, which is really worrisome to us. Factors, very important to know, early age at menarche, late menopause, non-breastfeeding females, and nulliparous females who doesn't have a baby, and obesity, short duration of breastfeeding, late age at first childbirth is very important. In society में होता जा रहा है, बच्चा 35 साल की उम्र में हो रहा है, that's a wrong thing, should not happen. 25 years, first kid should be there. It is a must. No? I'm wrong? Cannot be done. Okay, right. But later, first pregnancy later increase the chance of breast cancer. Very clear. There are data, there is evidence for that. Family history of breast cancer. We have screening protocols now. Who has a family history of cancers? So there may be a genetic change at the root level that can be diagnosed by evaluation by genetic studies, and we can come out with the diagnosis of that. Excessive alcohol consumption, obesity, lack of exercise and all. They are the risk factors. So we should have to prevent it, exercise, good positive attitude, rest, nutrition, maintain your good health. And screening ways are there to screen the breast by yourself. Once in a year after 45 years of age, we ask for a mammography once in 3 years. That is sufficient after 45 years of age. Self-breast examination every female should do once in a month after 5th or 6th day of menstruation. Clinical examination by the doctor or nursing once in 2 years, and mammography once in 3 years. That is sufficient. It hardly costs 500 rupees. But that is a good thing to screen, to diagnose if it is there, cancer at a very early stage. That should be done. And some of the abnormalities that females should know. How does it look like? Any abnormality on the skin of the breast and nipple area complex should be addressed. Redness of the skin, there should be any puckering of the skin, if there are any, in the palpate, there should be any, if there is any mass there, color changes are there, retraction of the nipple is there, retraction of the skin is there, any axillary mass if is felt. So what is cell-breast examination? You know the breast, how does it look and feel. If any abnormality is there in consecutive examination, should be addressed by a complete evaluation that cancer should not be there, that lump should not be cancerous. That is important. So this is our clinical examination once. So now if we talk of cancer treatment, mastectomy is an older treatment now. The breast can be saved, the complete disease can be removed with very good outcome. Crux is diagnose it at an early stage, get a complete treatment, right? So we have good survivors now. Preventable cancer, all cancers, we know 60% cancers are preventable there, and we have to take action now. And how can we diagnose cancer at an early stage, treat it completely? So we all have to be together, learn, be aware about it. It's a cancer, it's a preventable disease. It is curable in an early stage, and it is a treatable disease. Some myths. Is cancer a death sentence? No. We have a lot of survivors now who are there for 15, 20 and 30 years. It is not a contagious disease. You can eat, drink and it's not a contagious disease with them. And can cancer surgery or a tumor biopsy cause cancer? A lot of myths are there that we do a biopsy, it will spread to different parts of the body. It is not there. It doesn't spread. If it is a cancer, it is going to spread. Take a treatment completely is important. If someone in my family has a cancer, am I likely to get a cancer too? No, it may not. So if it's an early onset cancer or 2-3 members of the same family are having cancer, there may be a genetic disease or hereditary disease there that can be diagnosed by investigations. And we can say that, yeah, there is a syndrome or genetic disease. It is, right? And if no one in my family has had a cancer, does that mean I'm risk-free? No, nobody is risk-free. The environment we are living in today, the thought process that we have, what we eat, what we smell, everybody is at a high risk of developing any cancer in the world now. Positive thinking will definitely give a chance for cure of cancer, but treatment is very important for that. And people being treated for cancer cannot participate in their usual activities. No, there are patients who are cured of it now. They are doing their profession very well. I mean, farmers, businessmen, housewives, everybody. So what is crux is, diagnose it at an early stage, treat it completely, and a good follow-up is a must. Thank you very much.
काम करना है तो शायद ये संभव है, ऐसा कोई काम नहीं है जो संभव नहीं होता है। तो मेरी सर
I'll speak some words about cervix cancer, which is commonest, how to screen it, and some words about other screening also. So, after the age of 40, every female should go for a pap smear or CT scan once in 2 to 3 years. That is sufficient. These tests hardly cost 200, 500 or 1000, not much. Stool for occult blood is a must, and ultrasound abdomen of the abdomen should be done once in 3 years for males and females both. Because why this way? Because these are the commonest cancers that we get, and they can be diagnosed at a very early stage. If we do these basic, जैसे आप कॉम्बो टेस्ट करवाते हैं, हेल्थ चेकअप्स कराते हैं, उनमें ये टेस्ट नहीं होते हैं जनरली. We can add these tests also, so that cancer screening भी simultaneously हो जाएगा. That is the important.
अब इसको जो भी है with the consultation of family physician, कहीं भी आप जाएंगे तो हो सकता है कि वो टेस्ट ना करें, तो आपके जो भी फैमिली फिजिशियन रहते हैं उससे इस चीज़ को लिखा करके आप कहीं भी इस चीज़ को करा सकते हैं. तो ये एक है जो मैं बात कर रहा था तंबाकू की. अगर आज हम यहाँ पर उपस्थित जितने भी अपने समाज के लोग हैं, कम से कम एक जन को हम इस चीज़ को इंसिस्ट कर सकते हैं कि भाई आप बीड़ी या सिगरेट जो भी पीते हैं मत पीजिए. इज इट पॉसिबल? हाँ, देखिए क्या होगा ना कि जो आदमी दिन में 5 बार सिगरेट पीते हैं, भाई आप 4 करिए, 4 से 3 करिए, 3 से 2 करिए, और जो टाइम आएगा 1 महीने के अंदर हो सकता है 1, और फिर धीरे धीरे उसको लगेगा कि हमको और पीना नहीं है.